Have you ever seen a person becoming a chemical bomb? A person whose presence spreads poison in the air, or such a poisonous woman, by standing near whom people start fainting? Today, we will talk about one such woman who ruined the lives of many people while dying, and whose toxicity remains a big mystery even today. This is the story of a woman named Gloria Ramirez from Riverside, California, who was dubbed the Toxic Lady by the media. She lived with her 2 children and husband and was quite happy in her family. But one day something unusual happened which brought great disturbance or unrest to her happy life. Actually, on the 19th of February 1994, Gloria had to be admitted to Riverside General Hospital as she was undergoing a rapid heartbeat, and her blood pressure had dropped dangerously. She was in a state of sudden shock and was unable to speak because her heartbeat was not normal, and she was also having trouble in breathing. She was also diagnosed with cervical cancer, which she came to know about 6 weeks earlier, which worsened her medical condition even further. Doctors and nurses were trying to save her, and all the medicines being given to normalize her heartbeat was proving to be ineffective. The doctors also gave injections to make her sedate, but when they learned that Gloria was responding poorly to treatment, the staff tried to defibrillate her heart. But when the nurse took off her shirt to apply the defibrillator electrodes, they noticed an oily sheen covering Gloria's body, giving off a strange smell. After this, when the nurse applied a syringe to her arm to obtain a blood sample, it seemed as if there was a smell of ammonia in her blood, in which some manila-colored particles were floating. Soon after, one of the nurses who were attending to Gloria started fainting. She handed the tube full of blood to another nurse and fainted shortly after. After this, the second nurse also started feeling the same terrible smell and left the room immediately complaining of headache. But before the rest of the staff could inquire about her condition, she too fainted. Meanwhile, the third nurse present there also felt the same problems and fainted. But despite this, no one could able to understand what was actually going on there, as a total of 6 people were not able to treat Gloria as they had started having strange symptoms, ranging from fainting to shortness of breath that was somehow related to the patient. Soon after this, the hospital staff realized a major disturbance there and immediately ordered the removal of all patients from the hospital rooms and temporarily shifted them to the hospital's parking area. By then, all 23 patients admitted to the emergency room had become ill, and at the same time, 5 hospital staff members had to be admitted as well. But amidst all this, many efforts were put to save Gloria, but nothing worked and she died on the same day. As a result, a special team arrived in hazmat suits to handle Gloria's dead body, but they did not find any signs of poison gas or toxins in their investigation that may have caused the staff to faint. Her dead body was kept in a separate room and an autopsy was not performed for many days. The autopsy team conducted 3 autopsies of her dead body. The first occurred 6 days after her death, the second after 6 weeks, and the third just before her burial. On April 12, 1994, county officials stated the cause of death was heart failure due to the kidney failure brought on by late-stage cervical cancer. It took 2 months for county officials to release the body, after which Gloria's funeral could take place. Several months after this incident, a team was still working behind to find out the real cause of Gloria's death. The team later claimed to have found dimethylsulfone in Gloria's blood, and the cause of dimethylsulfone was the DMSO cream, which she probably applied to relieve pain from cancer. The smell of this cream was quite similar to that coming from Gloria's skin and mouth during her treatment. The symptoms which are usually seen when exposed to dimethylsulfone, the same symptoms were also seen in the hospital staff. In such a situation, it is certain that for this reason the medical staff also started fainting due to Gloria's blood coming in contact. But this story remains a big mystery for medical science, even today, as to how a person can become poisonous. That's it for today's video. Thank you for watching.